Hello, and how are you? Welcome to another segment of the Nursing Care Case Study series. So, in this segment, we are going to look at the final part of our case study, and this is on the summary and conclusion. How do we compile this, and which components should we include? Those who are new, my name is Winnie Barawa, and this channel focuses on doing lectures, lessons, and expert interviews pertaining to healthcare. If you've not yet subscribed, please do so by clicking on the subscribe button. Click on the bell for you to be notified when we post the next lessons. And as we always say, don't forget to comment, share, and also like our videos. So we've done several parts. We have checked on the different components by introducing the nursing care case study, like what is it, why is it important, what are the significance and the benefits of doing it. Then we checked on the components. The first component we did was the history taking. We headed to the physical examination, and then we did the patient admission process. We've done recently on the patient home visits, and we want to conclude this. Like, how do we do the summary part now and the conclusion? So be with me, guys, all the way to the end, and let's see. So the summary and conclusion part caters for different parts. It's not just summary and conclusion only. There's a part of doing the summary of the case study, having a conclusion, doing recommendation, developing the bibliography, and then finishing with the appendices. So what are all these, and how should one put them in the most organized and the most eloquent way possible in our document? So let's start with the first part, and that is the summary. In writing summary of the case study, we are told that a summary is a brief description of each subsection of the case study. Usually, we need to summarize this in a one page. So how do we put it in a way that is summarized? We need to have a short summary touching on the patient history, give a short summary on the physical exam, a summary on the literature, a summary on your home visits, on the management. Like, give us a brief of the story of this patient, So you will borrow key information from each segment of this patient, and then we summarize it. One page is enough, or one page document is enough. Now, depending on your institution requirements, some places you may have a written down document. In other places, you may have to type your document. But in regards of all this, make sure your document is one page. That is the summary part, should be one page. It's like an abstract when you're writing research. So give us a short description of the history, like 2 sentences. Then give us your physical examination findings. Here we are looking at key findings that you got that led us into getting the diagnosis. Then we have the literature. So give us the burden of the disease that existed. And then don't forget also the management that was offered to the patient, and tell us about the home visit and how you found the different needs and how you manage them. So summary is very specific. Here you're not doing a lot of stories. You're focusing on the needed parts and the different parts and how to compile them together. And then we move to the second part, that is conclusion. So conclusion borrows a lot of similarity from the summary. So from this summary that you've given, what are we concluding? So you give a summary key points or take away from the case study that can help reinforce the management and care of the patient. So if the diagnosis was a disease like tuberculosis or TB, which key points do we take away from the management of this TB patient? Maybe we'd like to say something like drug adherence is a big challenge when it comes to management of client with tuberculosis. Is that what you could conclude from the case? Or what are these key points that you wish to conclude on and you wish to use it to advise when it comes to reinforcement of management of this client? So reflect. This is a reflection case. You do not just conclude on anything. You need to reflect on the key challenges you faced while doing the study, and you want to give some significant statements regarding to that. So reflect on the practical significance of the finding in regards to nursing practice, education, and even research. So your conclusion is normally very short also, normally like a paragraph. It's not a very long discussion here. You give it like a paragraph or a few lines that shows you that This is the key takeaway that I'm giving from this whole case study. And then we got the segment on recommendation. So recommendation, we will recommend based on several parts. You can recommend based on the medical condition or the diagnosis. We can recommend also based on management, or you can suggest other steps that can be done to improve on patient care and outcome. A recommendation could be a new theory you are coming up with regarding the study. So if you did a case study on pneumonia, you can give a recommendation. What do you recommend pertaining pneumonia diagnosis? Are there certain approaches you feel if they are taken into consideration, they could lead into more improvement or better ways of managing pneumonia clients or respiratory diseases in general? What are we recommending on? And then the other way is, what are the best fit or best steps that you wish can be done to improve on patient management? So recommendations are normally best, or they are good because they really bring out the practical side or what can be done to improve. Some places they talk about further studies, like if from this case, do you have propositions of other studies that can be done in relating to this particular study that you've done, mostly based on the challenges you've made or based on the areas that you've identified that needs key focus in that particular case study. Following the recommendation, there's now the part of bibliography. So in other places, you can call them references. So here we're going to include books, articles, researches, or publications that contributed to this case study. You need to compile each and every document that you read or each and every article that you read to helping us developing that case study needs to be put as part of the bibliography. Normally, the APA referencing style is usually preferred mostly for the academic departments or academic purposes. So if you're into academics and you're doing this document, APA is usually a preferred reference style. So you can see how APA is done if maybe you don't know how it's done, but I can also do another video on that so that you can help those who are wondering how APA styling is done. So you're supposed to organize also the sources in terms of alphabetical order, like authors who start with maybe letter A, they start first. Authors with letter B, they follow each other. So the references are supposed to be organized in alphabetical order, so that authors with names starting with Z, they are going to be the last part of the list of the reference. So note, depending on your also departmental requirement, you may be required to have at least 10 sources of references. 10 sources, and in these 10 sources there need to be very updated sources. You don't take very old sources like 10 years or something like that. 5 years sources are very good because they show that they are updated. However, I want to give a disclaimer. If you're doing books like literature books, it's good that you check the most updated book in the market or in the sources. You find that there's some authors that don't update their books, and so they have overstayed for like 10 years, 15 years, they have never been updated. Most of the time, they may be good to read them through for guidance, but try to get the most updated source when you're putting in the reference list. And the last bit is appendix. And in the appendix here, you're supposed to describe all the tools that were used in the case study. And in all the tools that were used for the case study, here you just attach. So what do we attach here? You attach any document, any follow-up tool that was parcel or was important in making sure that this case study become evidence-based. So for example, you can attach the investigative results that you got from the different investigations done by our patient or the test. Then you can attach treatment charts to show the medication that the patient received during their management. You can provide a discharge summary copy to show the date the patient was discharged and the key follow-up management that was given on them. You can go ahead and attach the lesson plans that we are using during our home visit and the learning sessions that our client was going through while at home. Have monitoring chart for the nurses, for the nursing care, where you're doing either input output fluid charts, or if you're having neurological monitoring, weight charts, all these charts are quite important. Attach all these charts. The vital signs charts, you can attach all these charts as evidence of care. Then activity photos, like if you're going to their homes and you've done the first assessment, if you saw critical aspects that needs to be documented and you took photos, you can also attach these photos. They are part of the appendix. Then do the nursing care plans also. If you had written several nursing care plans, you can attach them as evidence of work. So appendix includes all tools that were used in the development of this case study, and they are normally used as evidence of work done. So if you really did your case study properly and you are collecting all these tools in each and every stage of your patient management or in your case study development, then these tools should be readily available to you, whether as a nurse or a student. But most of the time you may not have original. If you're doing the original one, you may scan, which is good. But if you're doing maybe photocopying, you can still use them. But you're not supposed to like go away with the originals of your client if it's a printed document. So that's all about the appendix part. So thank you so much for staying with me all the way to the end. Guys, don't forget to give a like. Just click on the thumbs up to show us that this video was really beneficial to you. Leave us with a comment also if you really felt you've understood a lot of the things we are discussing. And I always encourage you, please share it in your platforms. If you see there's a fellow that can benefit from this or they're struggling with the same topic that you really wish them to understand, please do that. And don't also forget to subscribe. We love to have more of you in our channel. Please give a subscribe. Click on that bell so that you can be notified when we post our next video. Until then, guys, bye bye and see you again.